Hello, my name is Phil Guzzetta. I'm one of the faculty here at Children's National Medical Center. I have been practicing pediatric surgery since 1981, and I was looking for a fellowship in pediatric surgery just as you currently are in 1977. Faculty at that time included Dr. Judson Randolph, Dr. Catherine Anderson, and Dr. Peter Altman. There are a lot of stories I could tell you about this amazing place, and someday, if you match here, maybe I will. But for now, I hope that this video will help you understand why so many, including myself, are proud graduates of this amazing training program.
Pediatric Surgery Fellowship training takes place at the Children's National Medical Center. Located in Washington, D.C., the hospital provides care for regional and international patients and offers our trainee exposure to the full range of pediatric surgical conditions, both inherited and acquired, along with its complexity. The Division of General and Thoracic Pediatric Surgery performs over 4,000 cases annually, offering our trainees a robust clinical experience, particularly in advanced minimally invasive and innovative techniques. Graduating fellows finish with an average of 1,300 cases encompassing all pediatric surgery index categories.
Children's National is ranked as one of the top 10 children's hospitals by US News & World Report every year for the last several years. What's really interesting for pediatric surgery is that our neonatal program has been ranked the best neonatal program by US News & World for the last 3 years in a row. And a large part of the neonatal program is very dependent on the neonatal surgical services that Children's National delivers. We have a very proud heritage in our surgical training. It started in the 1960s with Judson Randolph and has moved forward over the generations to really create a program that is as good as there is. I know it sounds perhaps boastful, but honestly, we're very proud of our program, and we think we're giving our fellows an outstanding education, as well as delivering excellent care to the patients who we treat. Our clinical program has all the important aspects of pediatric surgery. What's really unique to our pediatric surgical program is our Sheik Zayed Institute of Pediatric Surgical Innovation. We started this about 10 years ago and have really created an entity that forces collaboration between our clinicians and our engineers to create an opportunity that is not seen at any other place, in which we can create new innovations in the delivery of pediatric surgical care. We have engineers and clinicians working closely on collaborative projects that have allowed us to expand the horizons of pediatric surgery. We are very thankful for the funding that we got initially to create this institute, but it is quite incredible how far we have come. I do hope that you come and take a serious look at our program. I think we have a lot to offer, and we look forward to continuing to train the next generation of pediatric surgeons.
One of our emphasis here at Children's National is a robust and active minimally invasive surgery program, including neonatal surgery, diaphragmatic hernias, TES, all the way up into colorectal cysts. We expect our fellows at the end of 2 years of training to be skilled to do almost anything minimally invasively. They have to spend the time and energy. We'll be elbow to elbow with them for 2 years so that they want to do these skills, they can do them. My vision of the future of our division is to really diversify what we have already and really make excellent our forays into different areas of pediatric surgery. We have an expansive surgical endoscopy program where we're doing advanced endoscopic procedures such as POEM for achalasia, and we're going to hopefully expand into doing ERCPs. This is a family-oriented program. We take our fellows in for 2 years and we treat them like our kids. And I love getting phone calls, from fellows that have finished and they say, hey, I did this, I did X, Y, Z, I'm doing great. I love to hear that stuff, and that really keeps us going every day. And taking a fellow who's a first year and they're a little bit rough in that first couple weeks or couple months, and then seeing them at the end is really rewarding. And I think that's we're We're all like that in terms of our faculty, and we really take care of our fellows.
Together, the senior and junior fellows lead a busy pediatric surgical team. The Pediatric Surgical Service consists of a large team of general surgical residents, nurse practitioners, physician assistants, and medical students. Our fellows are encouraged and supported to develop autonomy and direct care. An attending surgeon rounds with the team daily to provide appropriate supervision while encouraging independent decision-making. The successful fellow takes ownership of the service, facilitates communication, and develops effective working relationships to provide compassionate care for children and families.
The Fetal program has a lot of strengths, particularly in diagnostics and cutting-edge imaging, and particularly GI imaging. Once we have an accurate diagnosis, then fellows can participate in that process of interpreting the images with the radiologist and then also translating that into a consultation that prepares families for a complex diagnosis and the surgical care afterwards. We're looking forward to developing a delivery unit, and that would be another avenue in which fellows could get involved in the very beginnings of fetal care and pediatric surgical care that comes in the immediate postnatal period. I think the fellowship has done a really good job of maintaining that tradition of teaching broadly and having fellows have autonomy throughout their training so that they can be well versed in complex decision making in the various aspects of pediatric surgery by the time they are finished.
Our trauma program sees about 600 activations per year. We have additional about 600 patients that are admitted to the rest of the hospital. The fellows are involved in initial evaluation of these patients in the emergency department, as well as the longitudinal evaluation of why the kids are in the hospital. Our trauma program is a verified level 1 trauma program by the District of Columbia, the state of Maryland, and the American College of Surgeons. When patients come into the trauma bay, because the fellows are board certified or board eligible in general surgery, they can serve as the attending for these activations. They take the lead role in the management of the patient in collaboration with the emergency department physicians. We've really tried hard to develop a collaborative environment in the trauma bay, and I think it's paid off for improved quality of patient care.
I'm the director of the Child and Adolescent Bariatric Surgery program here at Children's National. Since our first case in January 2010, we've done over 430 primary procedures for weight loss in children and adolescents, age ranging from as young as 4 years old to as old as 25 years old. Currently we're up to about 100 cases a year, which is by far the busiest adolescent bariatric surgery program in the country. Our outcomes are excellent, and we see patients from as far away as the Middle East to right here in our backyard. So hopefully you'll come join and be a part of it.
Our surgical education is also enhanced by exposure to multidisciplinary clinical programs that have been developed within our division and include adolescent bariatric, trauma and burn, fetal medicine, vascular anomalies, pediatric surgical oncology, thoracic and foregut surgery, colorectal.
I just joined the faculty here at Children's National. I'm really happy to be here. I just got started. It's already been pretty busy. I really wanted to join the faculty here for a number of reasons, one of which is that the people here are all incredibly awesome people that I know I can get along with and work really well with. There's a lot of room for growth here. I'm here as part of the general pediatric surgery group, but also the vascular anomalies clinic and as a part of the colorectal group. So I think it's a good mix of general bread and butter pediatric surgery, but also seeing a lot of complex and interesting disease processes and doing a lot of complex surgeries. And so there's a lot of opportunity here for me to contribute, but also learn a lot as well. Just first looking at the fellowship, these fellows see a lot of different complexity of cases. There's a whole breadth of diseases that I don't think there's anything here that they don't see, and that's just after being here for a couple of months.
So this fellowship program is really quite special because I think it really covers the breadth of all aspects of pediatric surgery. From the very basic to the most complicated in all the related fields, there are no gaps, there are no holes. Colorectal is now a very strong suit of this program. It represents a unique collaboration between pediatric surgery, urology, gynecology, and GI motility. And the pediatric surgical trainee gets exposure to those complex interactive cases. Washington, D.C.'s unique geography and its relationship with embassies is going to allow for a lot of international patients to get here more easily, and that just brings a increased breadth and depth of complexity to the program.
For many who live in Washington, D.C., D.C. is not just the capital. We are quick to point out that there's more to the area. Washington, D.C. is home to numerous cultural attractions, including several Smithsonian museums, theaters, and year-round markets. The area also encompasses a blossoming restaurant scene that will please any foodie, and plenty of nightlife venues, from the trendy bars along the U Street corridor to concerts at the Capital One Arena. District residents are also big sports fans who cheer on the Washington football team, the Wizards, the Capitals, and the Nationals. Each neighborhood in the district and its surrounding towns has its atmosphere. Residents gather for block parties, mingle at dog parks, and converse at coffee shops, creating an ambiance similar to that of a much smaller community. From beaches and recreational trails to cabins and cottages, you can't go wrong with a weekend spent outside the city proper. To the west, the scenic Shenandoah Valley will make you feel at one with nature. To the east, the shores of Maryland and Delaware will bring you closer to the sea. Organize day trips to Harper's Ferry, Baltimore, Annapolis, and Alexandria for added pleasure. Both Southern Maryland and Northern Virginia also feature numerous wineries and orchards.
Thank you for your interest in our program. With this short video, we hope that we spark some interest in our program. As someone who finished here, I can tell you that this is the best place to train. We have a lot more to offer, and we hope to see you soon. Thank you.